I'm Luis Mesa, and it's a pleasure to present on behalf of my co-investigators our study titled Radiomic Features of Renal Cell Carcinoma Metastatic Sites Can Predict BAP1 Mutation. These are our relevant disclosures. For many years now, mutations in indulging in short arm of chromosome 3 have been associated with clear cell RCC. It has been shown that these do not have a predictive or prognostic value. More, the TCGA Research Network has identified multiple mutations that have a prognostic significance. One of these is the BAP1 gene, which encodes for the BRCA1 associated protein, or BAP1, a ubiquitinous protein which regulates protein degradation. BAP1 mutation is present in 10 to 15% of patients with clear cell RCC, and it's associated with a higher Foreman grade, mTORC1 activation, and poor clinical outcome. Currently, tissue sampling is the method of choice for genomic assessment, whether that be by using archived specimens or real-time biopsy. The downside of these approaches is the inability to reflect changes in genomic profile and the surgical risk procedures entail. An alternative to this approach is radiogenomics. Radiogenomics is the association of imaging features of the disease and its gene expression patterns or molecular phenotype. The ultimate goal of radiogenomics is to provide additional data regarding the disease characteristics in a non-invasive manner. RCC is a good candidate for radiogenomic analysis given the relatively small number of commonly mutated genes that have been identified. Previous attempts using human interpretation of radiographic features identify characteristics such as renal innervation, presence of calcification within the tumor, and ill-defined borders to be associated with BAP1 mutations. However, there was a significant inter-observer variability. More recently, a study conducted by Feng and colleagues used patients from the TCGA database and corresponding CT imaging from TCIA and found that some imaging extracted from primary tumors were found to be predictive of BAP1 mutation. In this study, they only texture features and perform a two-dimensional feature analysis. Now, in our study, radiogenomics as a non-invasive method to identify BAP1 mutation in patients with metastatic RCC by using computerized extraction of imaging features. Eligible patients had a diagnosis of metastatic renal cell carcinoma, genomic testing performed in the course of routine care, and imaging for primary and/or metastatic lesions available in electronic medical records. For the radiogenomic analysis, we first acquire and process CT images from patients with metastatic RCC City of Hope. Images were then manually segmented and the regions of interest were identified for both the primary and metastatic lesions. Image analysis was then performed using Radiomics, which is an open source Python package used for radiomic feature extraction from medical images based on, among other things, texture and shape. Features were then correlated with BAP1 mutation status to generate Pearson correlation values. 88 patients were included in the analysis. Of this, the majority of patients had clear cell histology, 83%. 9 patients had BAP1 mutation and 79 were BAP1 wild type. Analysis of primary tumor yielded no significant associations between radiomic features and BAP1 mutation. However, in the analysis of imaging from metastatic sites using 1,315 radiomic features, we found that out of this, 111 features correlated with BAP1 mutation with a Pearson correlation value equal or greater to 0.2. And of this, 15 features correlated with a Pearson correlation value equal or greater to 0.3. The strongest correlated features belong to these two classes. Level dependence matrix, which quantifies the number of connected imaging units to a center voxel, and the gray level co-occurrence matrix, which measures the relation in pairs of pixels in a gray level image. In conclusion, by identifying a correlation between radiomic BAP1 in metastatic sites, our work may ultimately yield a non-invasive method of discerning mutational status. Our work is hypothesis generating and limited by our small sample size and the retrospective design of our study. Future efforts in populations are needed to strengthen our results. Finally, I would like to thank our patients and their families, as well as the Department of Medical Oncology and its chair, Dr. Rabi Salgia, for the support during this study. And last, but certainly not least, I would like to help my amazing mentor, Dr. Samantha Patel, and my great team at City of Hope. Thank you for joining us.